Welcome back to the Neural Health broadcast. This is your host, Dr. Joe, and today we have a great episode for you. We're interviewing Dr. David Traster of the Neurologic Wellness Institute. We're talking about all things brain health today, how to understand the approach of a functional neurology exam and a treatment plan. So we break it all down for you today. Dr. Traster does a great job of explaining it, simplifying it, but still respecting the complexity that is neurorehab. I think a lot of you, especially if you haven't heard from Dr. Traster before, are going to really enjoy what he has to say. So after a quick announcement, Dr. Traster with Understanding Brain Health. This podcast is brought to you by Delta Neural Health, located in Columbus, Ohio, where non-invasive, personalized care is revolutionizing the way we approach complex neurological issues. With cutting-edge techniques in functional neurology, functional medicine, and chiropractic care, we're leading the way in managing conditions like concussion, dizziness, brain fog, anxiety, POTS, attention, and more. To learn more, visit our website at deltaneurohealth.com. Hey everyone, welcome back to the show. Today we are joined with Dr. David Traster of the Neurologic Wellness Institute as we're going to talk about the brain and health. Thanks for joining us today, Dr. Traster.
Thank you for having me.
Of course. So this one's obviously pretty special because you and I go way back, and we helped to we launched the Neuro Wellness podcast and very first episode. So now we get to kind of redo it here. So I'm really excited to have you on today and share your knowledge with our listeners.
Well, thank you, and congratulations on the new clinic and the new podcast and everything you're doing. Obviously, me and everyone at NWI fully supports you and behind you, and we're excited for your future.
Thank you. Thank you. So before we get into the topic too much, can you just let our audience know a little bit about who you are and kind of why you got into the world of brain rehab in general?
Yeah, long story short, I was a typical teenager. I enjoyed basketball. I got hurt when I was about 17. I woke up from surgery just feeling sick, not knowing what was wrong with me. For about 9 years, I searched for answers and went to too many doctors. No one really knew, but people gave me different opinions. Eventually, 9 years later, I was diagnosed with Lyme disease. And so that was misdiagnosed for 9 years. But I was diagnosed with many other things, but so that was a good eye-opening experience of the healthcare system. And then for a few years, I then treated for Lyme disease and tick-borne infections and, different inflammatory conditions, autoimmune conditions, etc. And we did everything from my dad's a pharmacist, so from the most Western medicine medication route to eventually, unfortunately, my body became very sensitive and allergic to some of the medications. So it just didn't work for me anymore. And so it forced me over probably too long of a period of time to be more open-minded to things that weren't straight Western medicine. But eventually I got involved with things that are more, I guess, would be associated with functional medicine, and got more involved with things with supplements, with herbs, with homeopathy, with vitamins, with minerals. That kind of got me into chiropractic school, thinking that I'd be really developing more of like a Lyme disease wellness clinic that focused more on like metabolic health. And then when I went through chiropractic school, it opened me up to different ideas of the brain and the nervous system. And then I somehow got involved with Dr. Carrick, who we both know, who got involved with our school. And it opened my eyes to a more neuroscientific approach to the brain and how you could do these therapies to try to induce neuroplasticity or changes in the brain to create changes in brain function, which would translate into actual functional improvements in people's lives. And so that kind of opened this idea of saying, this is something like I've unfortunately been in healthcare for longer than my degree, because for too long I was a patient, right? And I thought I saw everything under the sun, from the weirdest of the weird, but then I see something that's completely looks weird and crazy. but it involves no pills, no herbs, no supplements, no medication, no surgery. It's people doing what looks more like physical rehab, and they're getting better with their brain, and all these symptoms are getting better. So that kind of blew my mind, and that's how I got involved with what you'd call functional neurology or chiropractic neurology, and Dr. Carrick and the Carrick Institute, who I now teach for. And that's how I kind of, eventually helped develop NWI, to try to create a clinic that helped people in different regions of the country. And hopefully we grow because most of my patients fly in to see me, and we make referrals all around the world. It's easier if we have more locations of people like you and other people who are more local to help people.
Yeah, and you started just with needing to find that help for yourself, and then you've gone on to open multiple clinics. You've trained hundreds, if not thousands, of doctors through your teaching. So you've really done a lot in the world of neuro rehab and brain health. So that's awesome.
Well, I appreciate it. Like I said, I'm happy to see you kind of branch off on your own and do your thing back in your hometown area.
Yeah. So um, when it comes to brain health, what do the lay people kind of need to keep in mind, or what do people need to do or to consider when it comes to keeping their brains healthy?
I would say the first thing to consider is understanding what is your brain,
Mhm.
right? If you have a bad foot, the first thing you might want to consider is, is it a bone in my foot? Is it a muscle? What's going on, making my foot hurt or making me walk weird or having problems? And is that an issue, right? When it comes to the brain, it's a little more complicated than a foot, but it's the same process. Is what is my brain, right? How does it work? Is it causing my problems? And then what do I do to try to treat it, right? And what are the options? So the first thing I'd say is when you think about the brain is one of the most complex things that we're aware of, and it's evolved over billions of years, right? And all different types of organisms. And the brain is really a network of networks of what starts with about a couple hundred cells in more of like a 2D kind of plate that develops into a 3D structure of 86 billion brain cells and 86 billion immune cells. And these together, like 160 or 170 billion cells, start connecting and communicating in a way that allows us to have human function. And what that means is everything that you do in life is a reflection of your brain. What you see, what you're hearing, what you're feeling. If you didn't hear what I'm saying, it's because somehow the input's not getting into your brain or your brain's not processing it. So every experience is relative to brain function. So when you understand that, you can understand if I can try to understand where people's brains need help, and if those areas they need help are causing their symptoms, is there a way, kind of like making a muscle stronger, to make an area of the brain stronger to allow me to make people's function better, right? And so when you understand the brain, you say, well, if I understand the development, is there a problem in development? I
Mhm.
know the first year in life, the brain's going to triple in size. When you look at most human beings can't take care of themselves relatively well before the first 10 years of life. When you look at most animals, it's maybe a day, a week, an hour before people, other animals are moving and hunting and doing what they do to eat. Humans take a little longer. And so when you look at development, your brain doesn't really develop fully until your first 25 years of life. Some argue up to 40 years. And then after 40 years, we all kind of slowly degenerate together over an extended period of time. But that's how long it takes for your brain to develop. And so when you start looking at development, you start realizing that your brain is an electric organ that creates electricity. Your brain actually creates about 23 watts of energy, which is enough to light up bulb, like an electric bulb. And so it's this electric organ, and it sends information. It could send information like up to like 260 miles per hour or so, right? And so it could send information really, really fast. And it has reflexes that could be 2 milliseconds, 7 milliseconds. Your fastest ones in your body to move your body in your eyes are about 7 milliseconds, in your body are like 25 milliseconds. So you have this really reaction time that allows you to interact with your environment. And when you look at the brain, just to put it in perspective, if you think of like a grain of sand, the size of a grain of sand is about 100,000 brain cells and about 1 billion brain connections. And so when you start looking in perspective, the size of your brain, which is bigger relative to body size than most any animal we know of, and you think about how many cells are in this one area, you have to ask yourself, what exactly is it doing?
Mhm.
Like, why is it different than any other organ in our body? And the answer is it's kind of like an operating system. When you look at your cell phone or your computer, the way that you're able to interact with your computer or your cell phone is through the operating system, allowing you to interact with the apps, allowing you to interact with the phone. In the same way, your nervous system is like an operating system for whoever's controlling the nervous system, which is a different conversation, but it allows us to interact with our environment. And so it allows this control system to say, I can move, I can speak, I can hear, I can have free will, I can be human. And when you have brain injuries, that functional ability decreases. And in some ways, people feel dehumanized, even if they're not, because they can have problems walking. And you don't realize that impact if you've walked your whole life until you have a problem walking,
Mhm.
right? You have a problem speaking, which is extremely difficult. You don't sometimes appreciate as a human being the impact humans have relative to other animals. Our human speech, based on what we know, is what makes us so unique relative to other animals, on top of other things. But speech is a big one that's very specific. So when you lose your speech ability with an aphasia, we have a patient who had a situation where she lost muscle mass in her tongue. And so just the ability to move the tongue was altered, but everything else was fine. And
Mhm.
so you have speech issues, it can make you feel very different and out of place. So brain injuries, anxiety, depression, movement disorders, dizziness, dysautonomia, these can be completely debilitating, where it's almost like a bug in your operating system that keeps flickering and you just can't get to the app or you can't open a program because something keeps popping up that doesn't allow the operating system to work. Right. So it's like I want to stand up. I just can't stand up no matter how much I try to get it to work.
Mhm.
And so when you look at the brain, I think a lot of people are starting to understand that we have an increase in neurodevelopmental disorders. Although we're better trained to observe them, we're better trained to test them. There's no doubt part of that better training is a demand of the supply of the amount of kids who have issues, right? And so we have an increase in developmental disorders. We have an increase in traumatic disorders, right? Although people are bigger, they're stronger, they're faster. Um, it doesn't seem like there is this rate of disability post-concussion with mild traumatic brain injuries as historically, but we are better tracking it, understanding it. But I think we're realizing more and more of these are problems. You're seeing more dizziness and dysautonomia and other types of disorders like this. You're seeing more neurodegenerative disorders, more
Mhm.
Alzheimer's, Parkinson's, younger, it's getting more common. So you're seeing different types of disorders that all relate to the brain. And then the question is, can we understand it better? Can we diagnose it earlier? Can we apply earlier treatment? And if so, what is the treatment necessary to apply to different conditions that we know of today that has worked in the past that maybe it's not being used as much anymore that used to work? Or what we are looking toward the future, what we can investigate to understand things that don't exist yet of how we can help people moving forward that no one's done yet.
Yeah. Yeah. And I like the analogy of the brain like a computer, and that kind of highlights how complex it really is. And then the way what you're explaining there really drives home, like I said, how complex the brain is. And you can imagine that all the conditions we see, all these functional connective issues, whether it be from a head injury or developmental in nature, because the brain is so complex, it's got the maybe a higher susceptibility for dysfunction, would you say?
Yeah, I think that the more complex a system, the easier it is to break down.
Hmm.
Nice thing about the brain is there's layers, like different networks. And so as we develop more complex networks. So as a baby, there's not much you can do. You don't have much of a frontal lobe. You got some reflexes allow you to move, right? And then as you develop, you can start walking more, you can start speaking more, you can start interacting more. but overall your rational thought or your cognition or your planning or ability to take care of yourself isn't there.
Mhm.
And then it gets older and you can start doing more, but your rational decision isn't fully there yet. Your understanding of the consequences. So executive decisions not all there yet. And so when you start looking at eventually we're all going to, the way the brain works, because the entropy, we're all going to degenerate.
Mhm.
And so I tell people in a nice way, after 40, we all kind of go downhill together.
Mhm.
And your job is to try to keep the brain connected and healthy as long as you can. So your disorders happen at age 150.
Mhm.
And so if you die at 80 or 90 or 100 or even 110, you're still doing pretty good,
Mhm.
right? And so
Mhm.
you want to keep your brain healthy as long as you can. And you want to do therapies to keep those connections healthy because it seems like, you have over, I think, what is it, 1,000 trillion connections in your brain. I forgot the exact number, but it seems like more stars in our universe. And when you look over how the brain degenerates, the less connections we have, the less ability and function we have. And this is what's going to happen to all of us. But there's no doubt that it seems like it's happening more rapidly. It seems like the nervous system is more fragile. It seems like there's more conditions related to the nervous system. And a lot of times the nervous system conditions can be secondary to immune dysfunction or other dysfunction. And so it's always involved with everything because your nervous system controls everything,
Mhm.
right? So your nervous system has input from everything in your body, has a processing center for everything in your body, and has an output to everything to your body. And what makes the nervous system interesting is the only output of the nervous system is to muscles, right? And so you have these 86 billion brain cells, and then they're going to all fire eventually out the body down to either spinal cord or the brainstem. And then there's nerves that come out, and they're either going to go to muscles that move your body, like skeletal muscles. They're going to go to muscles that move your heart, like cardiac muscles. They're going to go to out to different muscles that move your blood vessels or organs or glands, like smooth muscles.
Mhm.
And that's where it goes, right? And so when you look at the output of the nervous system, if you can measure these muscle qualities or interactions or abilities, it gives you a good window of the output of the nervous system on top of other metrics from QEEGs to fMRIs to MRIs to SPECT scans to all other things that you can do. But functionally, it's much cheaper to kind of specialize in movement
Mhm.
and the understanding of muscles and muscle actions. Because if you can understand movement and muscle activity, you actually have a nice window into the brain and the nervous system. Because unlike your heart or unlike your gut, there's no internal nervous system. Like if you remove your heart from your body, put it in a glass with a certain type of liquid, it could still beat. It might not beat great, it might be too fast, but it's still going. If you cut a nerve from a muscle and you put it in, muscle's dead, right? And so glands and muscles are kind of reliant on the nervous system. So by understanding muscle interactions, which is what we do here, or what you do, we can actually see different patterns of brain activity. And by then analyzing the input to the brain with the sensory system, with your vision, with your inner ear, with your taste, with your smell, with your information from your body, your proprioception, we could kind of measure how the input's doing, how the output's doing, and we could try to localize and kind of make an assumption of what's going on in the brain. And even more importantly, what we can do is we can take functional measurements and then we can do therapies to try to change the brain. And we can do therapies, what's called neuroplasticity, actually changing the connections of the brain. We can do therapies to change those connections, and it happens really quick. And so within sometimes even a minute or two, we can see some of these findings from the brain get better. Sometimes they can get worse if we do the wrong thing, right?
Mhm.
Sometimes they don't change if it's not significant. But it gives us like almost like some people wear like an Apple Watch or a different like wearable technology to track their autonomics, which is amazing. This gives us kind of a live time ability to kind of give us some almost like biofeedback or some
Mhm.
neurofeedback to say, if we do this, the brain likes it or doesn't like it. And if it likes it, we're going to do more of it. If it doesn't like it, we're going to try to understand why and do therapies so it's not so bothersome.
So with such a complex system as the human brain, you kind of mentioned that upon testing, you're looking at motor output of muscles.
Mhm.
Um, can you give our listeners a little bit more of an idea of what those tests might look like and some of the nuances of those tests that you're
Okay.
thinking about?
So let's take something that's a little different than maybe people think. Let's take dysautonomia.
Mhm.
Dysautonomia is a condition of the autonomic nervous system. When you look at the autonomic nervous system, it's a system in your nervous system that really regulates automatic functions, right? And one of the big automatic functions that you have is the control of your blood flow. When you look at the control of your blood flow is very important because you don't have a lot of it, right? You got a really big body. Your brain needs a bunch of it, right? Your brain's like 3 pounds. It uses like 20% of your oxygen, so it needs a lot of blood. And so when you look at blood flow, it's all about controlling blood flow. I always tell people it's like a water balloon filled up with 25%. It's not, the balloon's not all full. Your body's not all full. And so it's about how do you regulate blood? And then you ask, why do you need blood? Well, in general, you need blood to give oxygen to tissue. You need blood to give other fuel to tissue. And you need blood to kind of remove waste from tissue, right? And that could be brain tissue, that could be muscle tissue, that could be cardiac tissue, it could be any type of tissue. And so what's important for that is when you say, well, how does that happen? Well, it's the brain that regulates this. And it's a very complex system. And when you look at most of your blood vessels, like most of your arteries, except for a few scenarios, most of your arteries are really innervated by your sympathetic nervous system, right? You've got very little parasympathetic nervous system innervation to your arteries. And so it's not so easy as sympathetic versus parasympathetic, because what you really need to understand is how, because they work together, right? Everything you do is a combination of sympathetic and parasympathetic balance, and you need them both at all times. And so what you really want to do is look at the brain and say, is the areas that regulate the parasympathetic system working well? They could be working they could be overactive, they could be underactive. Are the parts of the brain that regulate the sympathetic system working well? They could be underactive, they can be overactive. And how are those interplay? And how we measure it is first, we work with cardiologists to make sure there's no heart issues and make sure there's no muscle issues of the heart or anything dealing with the heart, right? Number two, we make sure there's nothing going on with the brain, because some people who pass out, when you look at passing out, people POTS or different syncopes, it's a disorder of consciousness. And so we don't also want to assume it's always the heart, where you could have a stroke, you could have an aneurysm, you could have a tumor, and people could overassume it's dysautonomia. And so first we rule out the bad stuff. Second, when you look at muscle activity, we want to look at muscle activity of the arteries, right? Forget about moving your leg right now. We want to look at how you contract your arteries, and the autonomic nervous system goes out to muscles to contract arteries. So the first thing we like to consider is, do the muscles contract? And if they do, or if they don't, is there like a genetic condition like EDS or Ehlers-Danlos syndrome, Marfan syndrome? Is there a condition where there's a muscle issue?
Mm-hmm.
When you look at muscles, like you're asking about, you got to focus first on the muscle and say, is there a muscle condition? And if there's a muscle condition, it doesn't mean you can't help the person, but it creates a different program and different variables that you're going to have to adjust for. Next, you look at the nerves and you say, do the nerves go to the muscles that constrict the arteries? Because if all of a sudden you stand up and your blood pressure goes from 110/80 to 70/40, you might have an issue constricting some arteries, right, to kind of push blood back up. So we do a QSAR test. And a QSAR test is a test that's like a hand and foot scan. And what it does, it just says, you don't barely feel it for most people. And it's like gives you like 1 milliamp or so of electricity, and it measures the function of your nerves. So then we say, is there a nerve issue? And if there's not a nerve issue and there's not a muscle issue, then it's in the nervous system, right? And then we want to make sure it's not a heart condition, not a brain condition, from a medical condition. And then we want to start measuring the output into the nerves, which are healthy, into the muscles that are healthy, and saying, why are these muscles not being coordinated? It's almost like if I raise my right hand, I don't know if this looks like my right or my left to you. I don't know if it's flipped. But if I,
Yeah, right to me. Yep.
okay. So if I raise my right hand
Mm-hmm.
and I start moving it, I am activating muscles in my right hand, which means I need fuel to my right hand, I need oxygen to my right hand, and I need to remove waste from the muscles that are creating chemicals and molecules that need to be removed.
Mm-hmm.
And so that involves specific blood flow to my right hand, but not so much to my left hand. At the same time, this involves parts of my brain that are being activated to move my right hand. And so that involves really specific blood flow and coordination to the brain, which is different than the body. The brain is regulated different than the body when it comes to blood flow because your brain's really important. So it's got its own set of rules. And so if all of a sudden I get decreased blood flow to the area of my brain that controls my right hand, or it goes to my left hand for some reason, that's going to cause me to be pretty tired, right? Or pretty fatigued, or give me symptoms because all of a sudden I'm developing too much activity for the blood. It's called neurovascular coupling. I'm creating too much activity for the blood flow available. And eventually it's going to make me really fatigued, even though I'm not doing much activity, right? And so when we look at these type of activities, we then look at other areas of the brain. Now we do QEEGs at our clinic that allow us to look at brain waves and brain activity. But at the same time, when we look at areas of the brain, especially the brainstem, there's different things you can do. QEEGs are not the best at looking at deep areas of the brain, although there are algorithms that try to do a better job. You could do things like different reflexes and look at different hearing reflexes or visual reflexes or different cognitive reflexes, and try to get different reflexes, and you can measure from the entry point to the part of the brain and try to figure out where is that breaking down. And you're seeing more people use these type of tests to look at different kind of concussions or different hearing issues, etc. And then you could look at other muscle activity. So when you look at brainstem, we look at all the nerves that leave the brainstem and say, can we measure those nerves that leave the brainstem that are associated in areas that also do other things, right? I always tell people your brain cell is kind of like the boss,
Mhm.
where a liver cell is really important or a pancreas cell is really important, but it might only have a few jobs. Your brain cell is really important, but it has more, right? And so if one thing breaks down, everything breaks down that cell, and all these jobs can fail. So we look at different nerves that leave the brainstem, and there's a thing called your cranial nerves. And so these cranial nerves all have entry points into the brainstem, which integrate with local areas and local networks into bigger networks into bigger networks. So we start trying to localize different problems based on where the cranial nerves leave the brainstem. And so the first one is smell. We always look at smell. You see it with concussions. Now you see it with COVID. You see it with certain dementias early on for different reasons. Two is vision. So we look at certain visual disorders, especially with dizziness or anyone who has double vision or blurring vision.
Mhm.
We see a lot of people with visual disorders, but the eyes are normal, right? If they're not, we work with different optometrists or ophthalmologists, etc. So we do visual disorders. We test vision in multiple different ways. We look at 3, 4, 6. Those are different nerves that go to eye muscles, and 3 and 4 are a little higher up in the brainstem, and 6 a little lower down. And it gives you kind of some different ability to localize different areas of the brainstem. Looking at eye movements, and we record eye movements. I know you do that too. So we record eye movements and we do different things to try to understand how the eyes are moving and how that relates. Is it an eye muscle issue? Is it an eye nerve issue? Or is it a brain issue? Right. And so it's
Mhm.
the same kind of pattern looking at movement. We then look at cranial nerve 5, which is more to deal with your face, feeling of your face, but it also deals with feeling of different areas in your head, like your dura, right? And so it involves with different things with migraines. It also involves your jaw and movement of your jaw. We look at another nerve, which goes into muscles of your face, which is cranial nerve 7, but it also has a little to do with muscles that go into hearing, and it has some feeling in different areas. We go to another one, 8, which is inner ear. So we look at vestibular function. We look at head movements, especially with dizziness or concussions, but not even developmental disorders.
Mhm.
We look at different dizziness or different ability to move your head and eyes differently. Spatial orientation. We look at your hearing. And then we look at different muscles related to swallowing, related to speaking, related to breathing, related to your heart rate, related to neck muscles, related to your tongue. And that alone gives you like a lot of information about people's brain and people's brainstem, that when people have dysautonomia, those are more the control area regions that you can correlate to try to help out and try to get people understanding what areas of the brain might be dysfunctioning, and allows you to create some therapies to hopefully help decrease people's symptoms.
Mhm. And as practitioners, I mean, we just have to have a really good understanding of these networks and connections because you were listing off some very important testing, cranial nerve testing that we can do bedside. But say even we're looking at movement of the tongue, for example, which may not be something that many people look at in the medical world. But you're looking at not only just those cranial nerves, but also, you know, other nuanced things of that movement that may not directly be correlated to that cranial nerve, but other aspects that control motor output, right? So it becomes this layer upon layer of testing that you're doing and observing of your patients, right?
Absolutely. We got one patient speaking of tongue who I love her. I love her family. Her dad's a medical doctor. They're amazing. She unfortunately got a tumor that who knows why, right? And luckily, they're a great family. They researched it. They went to a great surgeon. He was able to remove it. Um, but she lost muscle mass of her tongue, not because of the nerve, but because of the brain area that controls the tongue.
Mhm.
But in a weird way, for some people to think about, next to that area of your tongue is areas of your eyes. So on top of muscle mass of her tongue, her eyes were shaking a lot in all different directions, which caused balance issues, which caused some double vision, etc. But just understanding the muscle mass of the tongue with the eye movements, you can know really well what's happening without an MRI, right? Was it right side versus left side? Is it high versus low? Is it front versus back of the areas of the brain? So you could localize these things pretty well. And then what's been amazing, and obviously they're a great family, they're doing tons of stuff. But over the last few months, we've been working with them. The muscle mass in the tongue is actually getting bigger and her speech is getting better.
Mhm.
Because again, it all had to do with tongue. Part of speech is the ability to make sounds, and making sounds is a combination of lips, tongue kind of activity, a palate, like, different in these combinations make these sounds that somehow we're able to put together to create language.
Mhm.
And so if you don't have the ability to move your tongue correctly, your ability to speak is going to be problematic and has nothing to do with your understanding or what you want to say, but it's almost like you want to move your leg, it just doesn't move,
Mhm.
right? And so what's amazing with certain therapies, even though the brain was injured, there's a lot of ability for recovery. And if you do therapies while you recover, you can accelerate that recovery and theoretically improve it.
Mhm. Yeah, I think you just painted a great picture of how powerful neuroplastic therapy can be. Why it has to be so individualized, how complex it can be, and just how far-reaching the results can be as well. Um, we are running just up on time, but I wanted to make sure that we had enough time for you to give us any closing thoughts on brain health and how our listeners can find you as well.
Well, yeah, I think and look at the brain, look at what therapies are available. Throughout history, neurology and neurologists haven't run much therapy. They've been more the people in the room that were able to diagnose, localize, and say, cut here or do this. Um, Over the last, I don't know, 80 years or so, when you look at medication, there's been more medication geared to the brain, which has been helpful, but it's not a cure for a lot of things. When you look at the therapies that are more on the future, you're seeing it more. Unfortunately, right now, it's like you got to go through different drug therapies to your insurance covers it. But you look like transcranial magnetic therapy or more electric different therapies are becoming more and more common. You're seeing more direct stimulation, alternating current, things like 1,000th the strength of TMS, which are also becoming more current and more popular. You're seeing neurofeedback and different kind of binaural beats. You're seeing visual therapies. You're seeing virtual reality therapies. And so what it means is that your brain responds to your environment in a very specific way. And the negative of medication is it responds more globally and generally to different receptors, which gives side effects. Where if we can do therapies with different environmental stimulation, whether that's a magnet, whether that's a laser or light or LED, whatever that may be, whether it's a movement, whether that's a thought, whether that's a sound, whether that's a light, if we understand the pathways and the anatomy of the brain, we can develop specific therapies that actually can create connections. I always use the analogy now we have a lot more connections in this, but if a function like moving your hand takes 1,000 connections, and at 500 connections, you just can barely move it, and at 0 connections, you can't move it at all. A lot of people are living at like 750. where they can move their hand. It's just not moving a little, it's maybe moving a little slower. It's a little shakier, but it's not till it gets to like 500 connections where it's so symptomatic, people are looking for health. And then the model is trying to do things to make the cell healthier. Like if you've got a medical condition, there's things in the medical world that'll help. If you don't, and you go in the functional world, they're trying to make the cell healthier, but you're not going to become a tennis player in the US Open if you just sit around and eat healthy. At some point, you got to practice tennis and you got to change these brain connections to be a better tennis player. And so the brain's the same way. How do you go from 500 connections back to 1,000? Well, nutrition is important. Supplementation could be important. Other things, mindset's important. The way to move your hand better is doing exercise that move your hand, right? Or even visualizing move your hand. And so you want to do therapies that are very specific to the areas of the connections you want to improve, to actually improve those connections that are functionally dysfunctional based on an evaluation or based on what you're dealing with. Because if you can increase connections in functional areas, your function will get better and you'll be able to have less symptoms in your life. And I think that's the future of the world, is trying to better quantify biomarkers to look at brain function, to understand which connections where are not where they need to be, whether it's too much, too little, or wrong connections. And how can we alter these connections after strokes, after concussions, after all types of injuries, or just performance enhancement, right? How can we alter brain connections to improve brain function, whether that's making your function better, whether that's always making your function better, whether that's just optimization or whether that's getting rid of symptoms or dysfunction.
And it
And
sounds like,
where you could find me is I am one of the owners of Neurological Wellness Institute. I'm in Boca Raton. We have a clinic in Chicago and in Wood, Illinois, and in Waukesha, Wisconsin. And then we help people out every day, as you do.
yeah. And just to summarize, it sounds like to have an adequate picture of your brain health, it all starts with kind of an individualized evaluation, taking your goals, whether it be improving your tennis serve or improving your dysautonomia symptoms, it all starts with that evaluation, and then someone like yourself to come up with that specific treatment plan to fix those, or to at least improve the functioning of those associated problems.
That's our game plan. And then if we can do any supplementation or nutrition, or everyone's got a unique patterns for their life and their brain. And so it's not that we only do that, but that's more what we specialize in because less people do, right? So we do other things, but I think a big future is going to be what you just said, identifying functional weaknesses in the nervous system and doing therapies to improve that for people, not just to improve temporarily short term, but long-term improvement for the rest of their life.
Awesome. Awesome. Well, this has been fantastic, Dr. Traster. I've been learning so much from you for a long time now, and I'm glad that our listeners are going to be able to learn quite a bit from you from this episode as well. So I really appreciate it.
Thank you. Thanks for having me.
Of course. All right, everybody, take care.